threshing out the key issues, the key factors that we're going to be discussing today and tomorrow under the banner of sustainable, modern, and responsive health systems. Clearly, lots of initiatives, lots of strategies underway. I would love to echo many of the points you made. Let me say one, perhaps. This was coming for some time. We're talking about external shock. It's nothing new. We knew that at some point, the aging, the obesity epidemics, there were a number of external shocks, the financial crisis being one of those, and that we need to reform our health systems. There is room for efficiency. Thank you for highlighting the equity issues, the investing in health, and particularly, which is where I like to bring the session later on, to talk about structural funds and many others that I would like later on to be discussing, to see what we do, as I like to say, Monday morning, after we heard all these inspirational discussions and speeches, what we do Monday morning to make a difference in our health systems. But now I'd like to introduce and invite the Regional Director of WHO, Zsuzsanna Jakab, who's going to give us a WHO perspective on these important issues. Zsuzsanna.
Minister Andriukaitis, Excellencies, colleagues, ladies and gentlemen. First of all, I would like to thank His Excellency, Mr. Minister of Health, for inviting me to this important event, and I would like to congratulate him for the success of the Lithuanian presidency and for his personal leadership in this. I would like also to thank him for putting this very important item, the health system strengthening, on the agenda of the EU presidency, and I would like to welcome the declaration right at the front at the beginning of this conference and say that WHO fully supports this declaration because its key messages coincide with the key messages that came out of our most recent European conferences. Ladies and gentlemen, let me say that there is no doubt that the crisis has presented health systems in Europe with a challenge, I could even say with a threat, as it has put health systems under severe pressure. But at the same time, the crisis also presented an opportunities for the European countries to strengthen the health systems. And what I would like to focus on in the coming minutes is to give you a short overview of what WHO has been doing in the European region to support member states in strengthening health systems, but at the same time also to consider the question that has been put to me by the organizers of this event, whether the crisis has helped or hindered the developments in the European region. We all know, ladies and gentlemen, that health policy, health systems, public health, they go hand in hand. In recent years, we had a number of opportunities with the European member states, milestone events, to renew the policies, strategies, and action plans in line with the changing environment. They are now all in place, priorities are clear and agreed with the member states, and the evidence is behind these policies. In Europe, we have made tremendous progress in the health outcomes in the recent years, recent decades, I would say. And we gained 5 years in life expectancy over a period of 30 years, which is a huge success story in our region. Maternal mortality was reduced by 54%. Circulatory mortality has been decreasing across the European region. And this is a tremendous progress to development, both economic as well as social development. However, at the same time, inequalities in health have also been increasing, both between the countries, but also within the countries. And this is extremely worrisome, and this is that we need to respond to. Therefore, we need action on several fronts to respond to this challenge. We need to continue our work for improved health outcomes and particularly healthy life expectancy and reduced inequalities as foreseen in the European Health Policy Health 2020. We have to take action on all the priorities jointly to reduce the disease burden from NCDs, but also the remaining threats from current communicable diseases. We have to act on the multiple determinants of health, including social determinants, and the policy recommendations on social determinants have to be mainstreamed into our policies. And we need to continue our work to strengthen health systems and public health and integrate the right policies and put governance and accountability right in the forefront of our activities. In the health system strengthening, the basis of our work is the Tallinn Charter, which states that health is wealth and reaffirms solidarity and equity as core values. It states strongly that today it is unacceptable that people become impoverished because of ill health. Health 2020, adopted by the member states in consensus last year, reinforces equity, solidarity, health gain, sustainability as the governing values of health as well as social policies. I would like to mention two important events that have just taken place. In October, 5 years after its adoption, we discussed the implementation of the Tallinn Charter at the high-level meeting in Tallinn. We exchanged inspiring examples of health system strengthening and also agreed on future directions. 2 weeks ago, we also marked the 35th anniversary of the Almaty Declaration on Primary Health Care in Kazakhstan, where we considered the status of primary health care, but at the same time also how to integrate public health functions into primary health care. The key outcome of the Tallinn conference was taking stock of what happened 5 years down the road from Tallinn, weaving together commitments from Tallinn and Health 2020. In the meantime, during these 5 years, several countries have seriously moved forward towards universal health coverage, like Turkey and Georgia in the broad WHO region. There has been a lot of thinking on how to improve health services, particularly how to address NCDs and multimorbidity, but also how to integrate the communicable diseases into the health systems. Accountability and governance are high on the agenda, and many examples were shared, including examples of health system performance assessment. There was a remarkable consensus on the way forward. Transformation of health systems towards people-centered health systems, which takes a holistic approach to health improvement and which puts primary health care and community care in the center and ensures better coordination and integration between levels and services, was strongly emphasized. Also, the need to synergize across agencies to have a unified front was very strongly emphasized, together with the need for leadership and change management. 2 weeks ago, we met in Almaty to celebrate the 35th anniversary of the Primary Healthcare Conference, which put equity for the first time on the international agenda and agreed to integrate disease prevention and health promotion with primary health care and put emphasis on community participation. The conference was a landmark event as we agreed to renew the concept of primary health care with all its key elements to respond to today's challenges. The conference debated how to further address the challenges that our societies face today, such as the persistent health inequities, the disease burden, and particularly disease burden from NCDs, the unfinished MDG agenda, but also the increase in chronicity and the co- and multimorbidities. It is clear that traditional approaches based on disease-specific, reactive, fragmented, and episodic interventions are no longer appropriate. These challenges call for a renewal of primary health care. The endeavor cannot be achieved by the health sector alone. We need other sectors on board, like the education sector and the social policy sectors. Most health systems are designed and incentivized to manage diseases and acute illnesses. Primary health care, where the traditional focus has been on reactive management of illness, is no exception. The time has come for a fundamental shift towards a primary healthcare model that promotes also health and well-being throughout the life course, mitigates the risks, and manages social determinants of health, a model that empowers and engages individuals and communities as partners and not as passive recipients. Universal health coverage, which gives access to services, including preventive services as well as rehabilitation, and protects the population from financial risks, is central to have healthy populations and well-functioning and well-governed health systems. It is relevant for the whole of the region, with growing commitments in the eastern part of the region, which makes us very pleased. At the same time, we receive an increasing number of requests from EU member states asking for support to help them, to advise them to safeguard universal health coverage. In recent years, we have been working closely with Greece, Ireland, Portugal, Cyprus, and Baltic states. How has all this been affected by the crisis? WHO Europe has been working with its member states to understand the challenges posed by the crisis and to support effective policy decisions. This slide reflects our work of the Barcelona office as well as the European Observatory, and we will soon publish 2 volumes, and the summary of this collaborative work will be launched here today in Vilnius tonight, and I would like to thank personally to the Minister of Health for giving us this opportunity. The impact of the economic crisis was discussed and reviewed at 2 European conferences, Oslo I in 2009 and Oslo II this year in April. And there was an outcome document that came from the Oslo II conference, which contains 10 clear policy lessons and recommendations to the policymakers that was in the meantime approved also by our governing body, the Regional Committee. It is critical to keep an eye on the longer-term challenges of health systems while navigating the crisis during austerity times. This includes strengthening universal coverage, whole-of-government support to NCDs, focusing on risk factors, and a primary healthcare-led health system, emphasizing health promotion and disease prevention. Fiscal policy should consider explicitly the likely impact of population health. Social safety nets and labor market policies should be part of intersectoral action that can mitigate the negative health effects of financial and economic crises. Health policy responses influence the health effects of financial and economic crises, and hence the choices made by ministries of health are important. In order to protect health and access to the needed services, it is critical to try and absorb budget cuts through efficiency gains rather than increasing patient charges at a time when health needs tend to increase. Public health services are proven investments that can improve health outcomes at relatively low cost, which is important as cost-effective health spending is in sharper focus during the austerity times. Fiscal policy should avoid prolonged and excessive cuts in health budgets, given the increased demands on health systems in times of economic downturn, except where it is clear that population access to needed services is not threatened. And then let me mention one more. Deeper reforms are unlikely to deliver savings quickly under time pressure. With each additional year of budget reductions, it becomes more and more difficult to absorb cuts without damaging access to needed services. For more fundamental reforms to service delivery, more time is required. There is no doubt, ladies and gentlemen, that the crisis has been hugely challenging from some of the countries of the European region. Public spending on health has fallen in many countries, sometimes in countries where it was already low by European standards. In a handful of countries, reductions in public spending on health have now been sustained over several years. In some countries, the health share of the government budget was disproportionately cut. Faced with reduced health budgets, many countries made efforts to ensure that patients did not suffer as a result. Therefore, they introduced reforms, opted for immediate efficiency gains, like lower drug prices or cost-effective services. Nevertheless, in spite of these efforts, there is growing evidence of negative implications for health system performance. These are often the result of reduction in health coverage, particularly reductions in population coverage and increases in user charges. Countries that reduced population coverage often targeted vulnerable people, such as poorer people or migrants. Over 25 countries increased user charges for essential services, including primary health care. As a result of reductions in coverage of effective health services, we are beginning to see evidence of increased financial hardships for individuals in some countries. From this, we get an idea of the ways in which the crisis was hindered. In some countries, it may be undermining progress on the path to universal health coverage. But there are also ways in which the crisis has helped. Importantly, it has provided clarity on key policy options. It has shown us that where there is a political will, it is possible for health systems to address inefficiencies such as inflated salaries or high drug prices. It has also shown us that coverage reductions can undermine equitable access to needed health services, which causes suffering for many individuals, particularly poorer people, but also those who rely on regular access to health care, who are the people with chronic conditions. So the clear message is that policies should focus on addressing inefficiencies and avoid damaging access to effective services. How else has the crisis helped? It has shown that there are limits how much can be achieved through efficiency gains. Deeper structural reforms, on the other hand, need time and requires additional investment and may not deliver savings immediately. Sustained financial pressure may result in policies that damage access to services. Efficiency gains may not be enough to bridge the gap between revenue and expenditure. This means that countries need to find ways to secure revenue for the health systems, especially in countries in which health spending is already low by European standards. Finally, the crisis has also highlighted the crucial role of governance, not only in strengthening health systems generally, but in ensuring they are resilient when they come under pressure. A key test for good governance is to ensure that policy actions in the short term are consistent with health policy and health system goals in the longer term. For example, moving towards and sustaining universal health coverage, protecting access, preventing financial hardship, promoting and prioritizing cost-effective services, ensuring people-centered coordinated service delivery based on primary health care and community care, protecting what works, and addressing inefficiencies rather than damaging access. We have a long history on working on universal health coverage. And now we must extend our work to the transformation of health services delivery. There are 3 new areas where we are working actively now. One is a framework of action towards coordinated, integrated health service delivery based on primary health care that we presented in the recent conference in Tallinn. The second is an ambitious multidisciplinary program on how we can make the health systems more responsive for better NCD outcomes. And the third one is to understand more the economic case and the need for investing in health promotion and disease prevention. And for this, we are working together with the OECD and the European Observatory to come out with an action plan and with a study with clear recommendations. We also continue our work on public health to finalize the public health vision. Of course, the main aim is to invest upstream, to invest into prevention, to invest into health promotion, and into the social determinants of health. As we all know, public health is a population-based approach which has to go hand in hand with the right policies and the system thinking. So let me turn then to the question posed in the title of my presentation: Strengthening health systems in Europe. Has the crisis helped or hindered? The crisis has provided countries with opportunities to carry out the needed reforms. In this sense, it has helped, especially since health systems have shown they can be more efficient. On the other hand, the crisis is also undermining health system performance. Evidence is emerging of increases in financial hardships for patients, rising unmet need among poorer people, and problems with human resources. The challenge we face now is to act on the lessons learned from the crisis. First of all, we need extreme caution in reducing coverage. Secondly, efficiency gains are positive, and we should use them to the maximum, but they are limited in scope. Thirdly, the importance of good governance and accountability cannot be emphasized enough. And fourthly, we need better monitoring of the impact of the crisis, as we have been doing in the last 5 years, but we have to do even more. Thank you very much for your attention. And of course, our aim is to understand health system sustainability, and that's what we are doing in this conference. Thank you.